This is a 13-year-old Belgian who had a history of nasal discharge. He'd been seen by his referring veterinarian about 2 months prior. We did an oral exam. The horse had a fair bit of halitosis at that time, and that veterinarian was able to sort of pull out this palatal crown fracture, just sort of fell out. It did take a couple months before the horse made its way to us, and we were able to do some imaging, and then Dr. Travis Henry was able to remove that tooth. So I left this part in here. Down here, it makes the slide a little busy and ugly, but I just wanted to leave this in just to point out, you know, again, CT is lovely for looking at teeth. We don't have the superimposition that we do with our traditional radiographs. And then we're able to manipulate these images, and so we can kind of look at every tooth individually, and sometimes we do have to change the alignment for every tooth, so we can see the details surrounding it, make sure we're not creating any artifacts. So as I said, this horse did have a palatal crown fracture of the 208, and then secondary sinusitis, and also some changes to the nasal cavity. So we can see the ventral conchobola, the dorsal conchobola are sort of deformed. So I don't know if he had an abscess up here before that kind of changed things, or exactly what had happened. So like I said, the horse had that tooth extracted, did a minimal buccotomy. Horse did well.